Hi there. My name is Kara Cope. I'm a pediatric physical therapist from Edmonton, Alberta. I'm also a person living with long COVID. As well, I've been involved with the Long COVID Physio organization since its inception in 2021. Hopefully, you've watched Module 1 and 2 already. In Module 1, Angela shared some basic facts and statistics about chronic and post-viral illnesses. In Module 2, Jennifer shared her family's story and their experiences living with long COVID. She also shared what students and parents want their teachers to know about chronic and post-viral illnesses. So let's begin with Module 3. What can educators do? We'd like to encourage you to learn about post-viral and chronic illnesses. Both Module 3 and 4 will cover a few different chronic and post-viral illnesses, their symptoms, and what you might observe in the classroom. We will discuss a little bit of the science behind the different symptoms so that you have a better understanding of why your student might be complaining of certain issues. As well, we'll give you examples of how your students might describe their symptoms to you. Secondly, we'd encourage you to please listen to your students and their parents. They are the best sources of information with regards to their condition. Many people living with chronic and post-viral illnesses have been gaslit or not believed by their friends or their family, or sometimes even their healthcare providers. Many chronic and post-viral illnesses are invisible, making it very difficult to explain to people. So please believe your students when they are sharing their symptoms with you. For some children living with long COVID, their parents might not even know yet what is happening with their child. They're just noticing that their child has some weird symptoms and they're not sure why they're happening. So please report anything that you notice that is out of the ordinary for any of your students to their parents. These changes could be in their behavior, it could be in their physical capacity, or it could be in their learning or in their cognitive capacity. We'll be sharing several resources with you today that discuss the latest evidence and best practices that we're aware of at this time. Many of the medical community are still learning about long COVID, so things are constantly evolving. In Module 5, I'll go into more detail about school accommodations. I would ask you to please try and implement these accommodations wherever possible. Children want to be in school, and they want to be with their friends, so please try to support them as much as you can. Long COVID Physio created 8 short videos ranging from 2 to 8 minutes that explain what long COVID is, why it's called long COVID, what some of the common symptoms are, the importance of pacing, etc. So please consider taking the time to review these brief videos to gain a better understanding of long COVID in general. Long COVID is a term that was coined by the patient community to describe people suffering with long-term symptoms following a COVID-19 infection. Now, there are a number of different definitions of long COVID, but the following points are consistent with whichever definition you use. Firstly, long COVID is an invisible illness. Children may look okay on the outside, but they're all messed up on the inside. Children are not able to put a cast over their heart or on their brain, like somebody who has a broken leg and is wearing a cast where you can clearly see that they have a leg injury. One of the few things that you might see externally on a child is that they might have a rash on their body, or they might appear flushed, or you might notice a change in the color of their skin. Secondly, long COVID is episodic in nature. Sometimes children's symptoms fluctuate from day to day, and they can be unpredictable. So yesterday they might have been able to complete a certain task, and today they can't do it at all. This makes things difficult to deal with in all aspects of life for kids, at school, at home, in their recreational activities, and in their sports. Thirdly, long COVID is a relapsing and remitting condition. Your student may be showing signs of improvement, and then all of a sudden they have a crash. This is not a car crash, but what we call post-exertional symptom exacerbation, or a worsening of their symptoms. Kids need to be careful to pace their activities to try and avoid these relapses. This is difficult when all they want is to return to school and to see their friends. And sometimes, even when they do everything right, they still might experience a crash or a worsening of their symptoms. So, as I said before, there are multiple different definitions of long COVID in children. For simplicity's sake, I'm going to share the World Health Organization definition with you. You might hear of other acronyms or names or definitions, but for today, we're going to stick with the term long COVID, and I'm going to highlight the important parts in the World Health Organization definition. So, firstly, children need to have a history of probable or confirmed SARS-CoV-2 infection. Unfortunately, many countries are no longer doing PCR testing, and many people are no longer doing home testing. That is why there's a history of probable as well as confirmed SARS-CoV-2 infection. Also, in the early days of the pandemic, tests weren't available yet. Secondly, symptoms need to last for at least 2 months and can't be explained by any other diagnosis. The symptoms need to have started within 3 months from the initial COVID-19 infection. Symptoms may persist after the initial infection, i.e., the child may have gotten sick and just never gotten better, or they can be new onset of symptoms after an initial recovery from the COVID infection, i.e., they could have recovered from the acute COVID infection, but a few months later, they start having some weird things happening in their body and they're not sure why. These symptoms generally impact everyday functioning, meaning it can impact their eating habits, it can impact their academic performance, it can impact their social interactions with their friends or family, and it can affect their developmental milestones. These symptoms may fluctuate or relapse over time, which also makes it difficult to figure out what's going on. So let's talk about 2 common misperceptions about long COVID in children. The first misperception: children don't get long COVID. Initially in the media, they were saying that kids don't get long COVID. Unfortunately, this was very wrong. There are many children suffering in our communities and around the world who are living with long COVID. The second misperception: long COVID is the same in children as it is in adults. Again, this is false. Long COVID symptoms in children and adolescents can be different than what adults experience with long COVID. And lastly, I just want to point out that a negative COVID-19 test does not rule out past infection in children. There are a number of people with long COVID who never had a positive PCR test or never had a positive home test. Next, I'd like to share these 2 references with you from Long COVID Kids and the Recover Initiative. They show you all the systems in the body that can be affected in a child or an adolescent. The Recover Initiative in the United States identified the most common prolonged symptoms in children. They were able to identify differences between school-age kids aged 6 to 11 and adolescents aged 12 to 17. What they found is that neurocognitive symptoms, pain, and gastrointestinal symptoms seem to be more common in school-age children, while a change or loss of smell or taste, pain, and fatigue or malaise-related symptoms seem to be more common in adolescents. Their most recent research investigated even younger children, and they found that infants and toddlers aged 0 to 2 years were more likely to experience trouble sleeping, fussiness, poor appetite, stuffy nose, and cough. And preschool-age children, aged 3 to 5, were more likely to experience dry cough and daytime tiredness or sleepiness or low energy. They do acknowledge that these symptoms are harder to identify in this young age group and are more based on what the caregivers can observe. So what might you see in your classroom? All of these examples are taken from children that I know personally who are living with long COVID, or I've taken them from the Long COVID Kids or the Long COVID Families websites. Both of these websites are excellent resources with regards to long COVID in children. Things that you might see in your students. Severe fatigue. This is debilitating fatigue that's unusual for their character, and it's not just feeling tired after going for a bike ride or for a run. It's where their whole body feels heavy, like they can't lift their arms or legs, or they can't lift their head off the pillow, or sometimes they can't even get out of bed for hours, days, weeks, and sometimes months. They may be tired or falling asleep in class. Again, this is unusual and more noticeable than just your regular teenager who's sleepy. Cognitive dysfunction or difficulty concentrating, word finding issues, or memory issues. I'm calling this cognitive dysfunction, not brain fog, as the brain fog doesn't clearly describe the neuroinflammation that is going on in the brain of the person who is living with long COVID. They may feel dizzy, or they may feel faint, or they might actually truly faint and pass out. They may have chest pain or chest pressure. Sometimes I feel like my heart is sore. Other times I feel like I have this pressure right across the whole front of my chest, across my sternum or my breastbone. And sometimes I describe it as I feel like I have one boot or two boots on my chest. Difficulty breathing. Sometimes it feels like you just can't get enough air into your lungs. Headaches. You might see your student rubbing their head or their temples or putting their head down on the desk. Headaches are quite common in children with long COVID. Now, I'm just going to read to you a few of the things of how children may describe their symptoms, and then I'm going to let you read them throughout most of the rest of the presentation. But a child may describe how they feel as, I'm so tired, or my legs feel wobbly or heavy, or my chest hurts, or I can't breathe, or my head hurts. Other things that you might notice. GI issues, meaning gastrointestinal issues or tummy issues. Your students might be complaining of their stomach cramping, or they might have diarrhea or constipation. They might have changes in their taste or smell. They might talk about how something tastes metallic-y or tastes like an ashtray. They might have pain in their muscles or in their joints. They might feel pins and needles, or it might feel more like electric shocks, or sometimes it feels like burning or just pain in their hands and feet. They might have rashes that just pop up that have no known cause. They might be sensitive to lights, sounds, or smells. They might be experiencing anxiety, depression, or mood changes because of all the weird things going on inside their body. Your student might describe it as, I don't want to eat that, it tastes gross. Or it's too bright in here. Or the other kids are too noisy. Or I feel sad, I miss my friend, I'm scared about getting sick again. And you can see all those other things there as well. And it's important for me to emphasize here that anxiety does not cause long COVID or long COVID symptoms. However, long COVID and its symptoms can trigger new feelings of anxiety, depression, or behavioral changes, or it can exacerbate them. Angela will describe some of the conditions that can cause these symptoms in Module 4. Long COVID Kids developed this handout called the Cautious Tortoise. It's a flowchart that aims to guide parents through the early steps of their child's journey after a COVID-19 infection, while supporting them to preserve their energy. They discuss how it's natural to want to get back to normal after being unwell, but unfortunately, Pushing through is one of the worst things that you can do, and it may prolong your recovery time. It's important for families to encourage their child to rest until they are feeling much better. And recovery isn't always linear, and finding the right path can take time, kindness, and patience. They encourage a cautious approach following an infection with COVID-19 and to watch for signs or symptoms that may indicate that their child has not returned to full health. This guide also provides guidance through an adaptive pacing approach for families who have a child with long COVID on determining when that child or teenager is ready to return to school. Families can also return to this guide following a reinfection with COVID-19 if their child's health has worsened. Let's delve into a little bit of the science and biology of some of the different conditions that can occur with post-viral and chronic illnesses. We'll start with the autonomic nervous system. The autonomic nervous system controls your automatic body functions, which are things you can't control, like heart rate, blood pressure, breathing, digestion, body temperature, sweating, etc. There are two parts to the autonomic nervous system. You have the sympathetic and the parasympathetic nervous systems. As you can see in the diagram, the sympathetic nervous system is your fight or flight system, and it increases your heart rate, breathing rate, blood pressure, blood flow to your muscles and organs, and causes things like your pupils to dilate. The parasympathetic nervous system is your rest and digest system. It increases your digestion and decreases your heart rate, breathing rate, blood pressure, and blood flow to your muscles and other organs that are not required for digestion. Dysautonomia is an umbrella term for disorders that cause dysfunction of the autonomic nervous system. A high percentage of children and adults with long COVID have dysautonomia. People with dysautonomia tend to spend more time in that fight or flight state. People often mistake these symptoms as anxiety, but they often happen without a provoking event. They can even happen when you're asleep. All of a sudden you wake up in the middle of the night, your heart's racing, you're having difficulty breathing, you might feel your heart beating in your chest, and it's very unsettling when it happens. Dysautonomia can be triggered or worsened by viral or bacterial infection, or even a concussion. These symptoms can vary, and unfortunately, there is no cure for dysautonomia. So, what might you see if your child or your student is experiencing dysautonomia? Some of the things that children might experience are they might feel dizzy or lightheaded when they go from a lying down position into a sitting or standing position. They might have difficulty standing still in one spot, but if they move around a bit, then they feel better. They might have difficulty walking or have poor balance or feel like they're going to topple over. They might feel their heart beating in their chest with an increased heart rate, or they might have a decreased heart rate and not feel very good. They might have vision changes, such as double vision or blurry vision. They might have digestion issues. So again, they might have stomach cramping or significant pain in their tummy. They might have diarrhea, constipation, or some children can even develop gastroparesis, which is essentially a partial paralysis of the stomach where the stomach just doesn't empty properly. They might feel nauseous for quite a bit of the time, or they might even start vomiting for no known reason. Fatigue, again, it's that crushing fatigue where they just can't lift their limbs or they can't lift their head off the pillow, not just being tired after running down the street or going for a bike ride. Cognitive dysfunction and headaches are really common. So they may have word finding issues, their memory may be quite affected. Some people are unable to read. They may have difficulty with writing, or with the younger kids, difficulty with their drawing. Poor sleep, so they can sleep the whole night but still wake up feeling quite unrefreshed. So if you look in the image here of the umbrella, it shows you all the different conditions that can come under dysautonomia. And if you look in the top left, there's a condition called POTS, postural orthostatic tachycardia syndrome. And that's what we're going to talk about in the next slide. So, as I said, POTS stands for postural orthostatic tachycardia syndrome. And it basically means that the child's heart doesn't like it when they assume a vertical position. So when they go from a lying down position to an upright position in sitting or in standing, most of the blood flows down to their pelvis and their legs. And as a result of that, the heart starts beating faster, trying to get that blood back up to the heart and to the brain. This may cause the child to feel dizzy or have blurry vision, or sometimes the child will even faint and lose consciousness. Other symptoms that children might complain of are increased heart rate, heart palpitations where they feel their heart racing or pounding in their chest, chest pain, or chest pressure. So let's talk about what you might see in your classroom. Things you might notice is that your student might go pale, or they might have develop purple hands or feet, and this is just from the blood pooling in their extremities and not being pushed effectively back up to the heart. People with POTS do not tolerate heat very well, so if your classroom is very warm, or you're outside on a hot sunny day, or you're at a pool for swimming lessons, or a humid kind of area, you might notice that the child starts flushing, where they get redness in their face, their neck, their upper body. That you may notice that the child has difficulty breathing. They might start sweating, or they might get the shakes. They could feel dizzy, lightheaded, nauseous. They might faint on you. And if they do faint, when they're lying down on the ground on their back, just try and lift their legs up to get the blood going back to the heart and to the brain. Another thing you might notice is just an inability for them to cope with something that usually wouldn't upset them. And so it's a little bit different, like out of their character. How a child might describe it, it's really difficult for children to verbalize what's going on when you're having all these weird things going on in their body. They might say their hands are clammy, or their heart's beating really fast, or they feel like they're going to fall down, or they just really don't feel good. But it is really difficult to describe what's going on in your body when you're feeling these effects. So let's discuss some ways that you can help children manage their dysautonomia and their POTS. From a safety point of view, please notify your students' parents immediately if they have any complaints of new or unusual chest pain. That way the parent can talk to their child and determine what steps need to be taken next. Please encourage your student to drink lots of water and electrolyte drinks throughout the day, and permit salty snacks throughout the day. Water and salt help the child to retain more fluid, which increases their blood volume and their blood pressure. This helps the body to push that blood back up to the heart and to the brain. Children may need to be excused more often to the bathroom due to the increased water intake, or due to the stomach issues that they may be battling, whether it be diarrhea or constipation, or just stomach cramping pain. Please try to avoid long standing periods with your student with POTS or dysautonomia. Please have a chair for them if there's a lineup that they need to stand in. And if they have an activity where long periods of standing is required, please have a chair for them. If the student gets overheated in your classroom, please give them an ice pack or a cold, wet towel that they could wrap around their neck to try and cool them down a bit. And if they get dizzy, please let them lay down, or if they're in sitting, please encourage them to put their feet up, and that way that'll help to get some of that blood back up to their brain. Next, we'll talk about another post-viral illness called ME/CFS. ME stands for myalgic encephalomyelitis, which is more the European term, and CFS stands for chronic fatigue syndrome, which is more of the North American term. ME/CFS is a devastating, chronic, multi-system illness, often triggered by an infection. It's associated with changes in the nervous system, the immune system, and cellular energy production. It leaves people with the inability to recover normally following exertion, resulting in extreme fatigue that lasts longer than 6 months. This fatigue is devastating and long-lasting and affects a person's normal functioning of daily life, such as dressing, bathing, feeding oneself, attending school, taking part in family and social life. It can leave a child bedbound or housebound. Sleep is often unrefreshing, meaning that the child still feels exhausted in the morning, even after a full night's sleep. They can also experience cognitive dysfunction or orthostatic intolerance. OI, or orthostatic intolerance, is a symptom of dysautonomia where one does not feel well when standing. It is similar to POTS, postural orthostatic tachycardia syndrome, except that the person's heart rate doesn't go quite as high as it does in somebody who has POTS. A large number of people with long COVID, but not all, end up being diagnosed with ME/CFS. Some papers say just over 50% of people with long COVID develop ME. On the next 2 slides, I will talk in more detail about what is meant by chronic fatigue and post-exertional symptom exacerbation, which are both core symptoms of ME/CFS. I've also included a link here to a documentary called Unrest, which is about a woman who documents her illness journey. It is well done and really captures how devastating myalgic encephalomyelitis can be. Okay, let's talk about chronic fatigue. So once again, I just want to be clear that chronic fatigue is not just feeling tired. It's a persistent feeling of exhaustion. You feel like you constantly have the flu, and rest does not help you to feel better. This fatigue is not caused by overactivity or exertion, and it is not proportional to any activity that you performed prior to the fatigue. Those with myalgic encephalomyelitis and often long COVID experience this debilitating fatigue and have limited energy for even the most day-to-day basic activities such as showering or eating. When I was really sick in 2021, the only thing I could do was have a shower, and I could only do that twice a week. I would have to rest for the rest of the day and all of the days in between. This is a prime example of how fatigue can greatly impact your students' daily activities and their quality of life. People with chronic fatigue can feel like there's no more energy left in their battery, or that it only charges to half or a quarter of its full charge, and that it can never ever get up to that full charge level. Many will experience this boom-bust cycle where they start to feel a bit better, so they start to do a little bit more, then they overdo it, and then they crash and have a worsening of their symptoms. Then they have to rest more again. Then once again, they start feeling better, so they do a little bit more again, and then they crash. I have experienced this boom and bust cycle so many times in the last number of years. It's very difficult to figure out how much energy your body can use before it starts to crash. So if it is difficult for an adult to figure out, you can imagine how hard it is for a child to figure that out. Chronic fatigue is a constant thing that all of us with myalgic encephalomyelitis and long COVID are dealing with. Let's talk about post-exertional malaise or post-exertional symptom exacerbation, PEM or PESE. These terms are often used interchangeably. I prefer post-exertional symptom exacerbation or PESE because I think it better describes how your symptoms worsen. Please, please, please learn about PEM and PESE. It's a cardinal symptom of ME/CFS, meaning that it is a primary or major symptom by which a diagnosis is made. Unfortunately, many children and adults with long COVID experience PEM and PESE, as over 50% of us develop ME/CFS. Post-exertional symptom exacerbation is a worsening of symptoms after exertion. It's often experienced 24 to 72 hours later. Many people in the patient community call this a crash. You can't trust your body when you're doing something. You might feel okay doing it, but then a day or two later you pay for it and your symptoms worsen. Post-exertional symptom exacerbation can be caused by a number of different triggers, and you can see in the Bateman Horn Center image there are 6 different possible triggers. It can be a physical trigger, such as participating in gym or recess. It can be a cognitive trigger, such as attending school or reading. It can be something emotional, positive or negative. It can be due to orthostatic stress, which means being in an upright position, like sitting at a desk or standing. It can be due to something sensory, like a loud classroom or bright fluorescent lights, or somebody's perfume or cologne. It can be environmental, like a hot day or a change in barometric pressure. Crashes are unpredictable. And if you're familiar with working with children with post-concussion syndrome, these children with post-exertional symptom exacerbation often present quite similar. Okay, let's talk about some of the ME/CFS symptoms that you might notice in your classroom. First, let's talk about flu-like symptoms. Your student may experience a sore throat, headaches, or a low-grade fever. This is seen more specifically in people with ME/CFS. Unfortunately, these symptoms can last for days, weeks, months, and sometimes even years. You may notice your student has that severe fatigue that we were just talking about. You may notice them looking quite tired or falling asleep in your classroom, or they're not able to participate in gym or phys ed. And that's a big red flag. Children with ME/CFS do not tolerate physical activity or exercise well at all. Your student may have complaints of muscle weakness, or their muscles might be sore, or they could complain about pain in their joints. You may notice them experiencing cognitive dysfunction, meaning that they might have issues with word finding or processing or memory issues. Your student might be sensitive to lights, sounds, and smells. For example, some people can't tolerate the sun, so when they go outside, they need to wear sunglasses. Loud noises, like a class full of excited students, can be difficult for your student to tolerate. They may need noise-canceling headphones to concentrate when they are reading or working on an assignment. Your student may notice certain smells totally repulse them now, even if it was something that they enjoyed smelling before. They become very sensitive to lots of different sensations. How a child might describe it? My legs feel wobbly. The other kids are too noisy. Or it's too bright in here. Managing chronic fatigue and post-exertional symptom exacerbation. It can be very difficult to figure out how much energy your body can use before it starts to crash. This is a constant challenge for people with both myalgic encephalomyelitis and long COVID. Long COVID kids developed this handout called Pacing Penguins. It's a lovely handout that shares tips on how pacing can help to support a child to manage their energy, with the hopes of seeing an improvement in their symptoms. Resting and pacing are a key strategy in learning how to manage chronic fatigue and minimize that post-exertional symptom exacerbation. Children's bodies need time to recharge with rest. This activity management strategy helps them to prevent worsening of their symptoms or to decrease their symptoms after overexertion. It's important to note that pacing is not a strategy to avoid an activity, but it's more a way to manage the limited energy that the child has. They can no longer trust their body and push through their symptoms like they might have done before. The goal is to get to a more stable and predictable symptom level, and then once you reach that symptom stabilization, then you can gradually try and pace up and try to increase your energy envelope. Let's talk a little bit about the spoon theory and the energy envelope. The spoon theory basically means that people have a finite number of spoons or units of energy per day. They must ration these spoons throughout the day, and if they exceed their daily number of spoons, then they may experience a crash or a worsening of their symptoms. An energy envelope is the total amount of energy that you have each day to accomplish things. You allot points to each activity that you do throughout the day. You have a maximum number of points that you cannot exceed for the day. So, for example, having a shower might be 3 points. Attending a class might be worth 4 points. Attending a medical appointment might be 5 points. Playing with the dog in the backyard might be 2 points. However, you may only have 10 points that you are able to use each day. So you have to pick and choose your priorities of what you want to accomplish each day. Energy management is very challenging. Thank you for taking the time today to listen to our different modules. Please proceed to the next module where you will learn more about what you might observe in your classroom. Angela is going to talk about mast cell activation syndrome, some neuropsychiatric syndromes, and some cognitive symptoms. Then in Module 5, I'll discuss some practical strategies that you can put into place in your classroom. Thank you very much.